So the Oncotype DX test needs to be ordered by a physician. And depending upon the patient's situation, a physician may suggest it to help make a decision about whether or not the patient is a candidate for surveillance, or if a patient has read about this or heard about this test and wants to bring it to the attention of his physician and ask about it, that's perfectly appropriate also. But a patient cannot directly ask to, or rather the patient cannot contact the company and have the test done. The test needs to be ordered by a physician, and the report goes back to the physician, and the intent then is that the physician and the patient get together again, discuss the results of the test, and then make a joint decision about what the best management is. So other forms of Oncotype DX, particularly for breast cancer, have been on the market for a long time, about 10 years or so. So many physicians are familiar with the concept of taking tumor material and looking at gene expression to help manage patients. The prostate Oncotype DX test was only released on the market in early May of 2013. And so there may be many physicians who are not familiar with the concept or with the specific test yet. So if a patient knows about it, it's certainly appropriate to ask their physician about it and help educate the physician about whether or not it's appropriate for this particular patient's situation to order this test.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.